I am Dr. Pratap Rathod. I have done MD in forensic medicine. Today's video will continue with metallic poisons. In that, we'll discuss about copper poisoning and iron poisoning. Copper has a metallic form, is not poisonous like any other metallic pure metals. Copper is also not poisonous. Exception is the lead, which is purest, is also poisonous. Copper compounds are powerful inhibitors of enzymes. They combine with enzymes and inhibit the enzymes. Poisonous compounds of copper include copper sulfate, which appears as also known as blue vitriol. It appears as blue crystals. Then copper substrate, also known as verdigris. It has appears as bluish green masses of powder. Absorption. Copper is normal constituent of body. It is present in the body about in 150 milligrams. Safe limit to intake is 2 to 3 milligrams. It is absorbed through lungs, mucous membranes, and raw surfaces of body. It is excreted more by the bowels than by kidneys and traces in saliva, bile, milk. Coming to signs and symptoms, when the person consumes large amount of copper, its symptoms appear between 15 to 30 minutes. There is a metallic taste, increased salivation, burning pain in stomach with colicky abdominal pain, thirst, nausea, erectations, and repeated vomiting. The vomiting matter may consist of may look blue or greenish in color. There is diarrhea, which may be constraining, and motions will be liquid or brown, but not bloody. Acute inhalation of large doses of copper can cause upper respiratory irritation, resulting in sore throat and cough. That if it is present in the eyes, cause conjunctivitis, papillary edema, sinus irritation may also occur. Nasal mucous membrane may show atrophy with perforation. Exposure to skin may cause irritant dermatitis. Then severe exposure may cause greenish blue discoloration of the skin. Then in kidneys, it can cause oliguria, hematuria, albuminuria, acidosis, and urea may occur. In severe cases, there may be in blood, it may cause hemolysis, hemoglobinuria, methemoglobinemia, jaundice, pancreatitis, cramps of legs, spasms, and convulsions may occur. The breathing becomes difficult. There may be cold perspiration, severe headache, followed by paralysis of limbs, followed by drowsiness, insensibility, coma, and death may occur due to shock. In the usually later stages, death usually occurs because of hepatic and renal failure or both. Fetal dose of copper sulfate is 10 to 20 grams. Copper substrate is 50 to 30 grams. Fetal period is 1 to 3 days. Coming to treatment, stomach wash is the usual treatment. 1% solution of potassium ferrocyanate is added in stomach wash to remove unabsorbed copper. Emetics are contraindicated. Then demulcents are the drinks for insoluble albumin to prevent further absorption. Hemodialysis is useful in early stages of poisoning. Castor, again, it's form of demulcents given to remove poison from the intestines. Chelation is the main line of therapy by giving penicillamine ETR BL. Going to postmortem appearance, the skin may appear yellowish color because of jaundice. Greenish blue froth may be seen because of color of copper. Gastric mucosa of the stomach may contain greenish or bluish in color. Gastric mucosa may be congested, swollen, inflamed, or occasionally eroded. The liver may be soft and fatty. Spontaneous accumulation of blood and degenerative changes in proximal tubules of kidney may occur if the kidney damage failure is present. Come to chronic poisoning of copper. Again, some form of metals get deposited in long term and cause chronic poisoning. Similarly, copper can also cause chronic poisoning. It occurs in workers working in metal due to inhalation of dust or from food poisoning contaminated with verdigris. Chronic inhalation of copper sulfate spray can cause Wyniard Spray's lung disease characterized by histocytic granulomatous lung. Chronic poisoning also causes Wilson disease, which is characterized by gradual anemia, green line on the gum, nausea, vomiting, colic diarrhea, malaise, peripheral neuritis, degenerative atrophy of muscles, and may occur. Sometimes it may be deposited in the eyes also. The presence of copper deposit in the tissue is called as chalcosis, and it may deposit in cornea resulting in pigmented ring in the deeper layers, which is seen in case of Wilson disease. Their rings may be seen. Chronic contact with swimming pool water containing of algicidal copper chemicals can cause greenish discoloration may also present. Testing of copper. When solution of tissue sample is mixed with ammonium hydroxide, it gives a greenish bluish precipitate, which is soluble in excess forms of blue solution. That is one of the tests to detect the presence of copper. Coming to circumstance of poisoning, so it is rarely used for homicide because of its color and again taste. Suicidal cases also very rare. Accidental cases are common, mainly because it may be accidentally consumed. or it is eaten in the food contaminated with the verdigris, which is formed when action of vegetable acid with the copper cooking vessels. So if there is copper cooking vessels which is not properly tinned, then when it comes contact with vegetable acids, it forms verdigris, which is poisonous. Children sometimes swallow copper sulfate attracted by its color. Sometimes salts are also taken internally for abortion. Rarely it is used as a cattle poison. Now coming to uh, poisoning from iron. Iron again it is a common constituent of body. It causes increased capillary permeability, post arterial dilatation, release of hydrogen ions, inhibition of mitochondrial functions, and has a corrosive action when it is consumed in from the orally. Unbound iron circulates freely and is distributed within the cells and disrupts the physiological mechanism of the body. So, free iron ions has a poisonous effect. It causes also the corrosive effect. It causes increased capillary mitochondrial inhibits mitochondrial functions, and also cause disrupts the physiological mechanisms. Coming to symptoms of iron poisoning, they are divided into four stages. In the first stage, it starts from the few hours. There is ingestion of causes vomiting, abdominal pain, hemorrhagic gastroenteritis, acidosis, and coma maker. In second stage, it starts after 6 to 24 hours, in which patient is symptom free. Later on, in third stage of 24 to 48 hours, there is metabolic acidosis, jaundice, hypoglycemia, shock, coma, and hepatic and renal failure occurs. In the last stage, after 1 to 2 weeks, the complications such as gastric rupture and pyloric stains occurs because of corrosive action. Beta dose of iron is 20 to 30 grams. Beta phase is 24 to 30 hours. Treatment: stomach wash with 5% sodium bicarbonate solution. 5 to 10 grams of desferoxam at the end of lavage is done. Give plenty of egg and milk to form iron protein complexes. It forms like a demulcent. It is useful. Magnesium hydroxide 1% solution orally. Desferoxam again, it is a chelation of choice in case of iron poisoning. Hemodialysis excessive transfusion in severe cases is useful. Post-operation severe cases, gastric mucosa show hemorrhagic necrosis and perforation of gastric or jejunum wall. Liver may show hepatic necrosis and kidneys and degenerative reticular changes. So there are no typical changes, but only corrosive changes will be seen. These are my references. Thank you.